Good morning, students. Today we are going to discuss about diabetes. Now, today's subject is public health and hygiene and nutrition. Under this subject, we are going to deal about non-communicable diseases. Non-communicable diseases. What are non-communicable diseases? Which cannot be transmitted to others. Those are called non-communicable diseases. What are the examples of non-communicable diseases? Non-communicable diseases are, namely, we can take heart attack, diabetes, hypertension, etc. Okay? Today we are going to discuss about diabetes. What is diabetes? Diabetes is a lifestyle disease. In India, in near future, India is going to be the capital of type 2 diabetes. So now we are going to discuss about what is diabetes, what are the symptoms, what is the risk factors, what are the types, what are all the is diabetes meant. Okay, what is diabetes? What is diabetes? Diabetes is a metabolic disease in which the body's inability to produce any or enough insulin causes elevated levels of glucose in the blood. What is this? Diabetes is nothing but it's a metabolic disease. Body's inability to produce sufficient insulin or it can't produce any insulin. Okay. Next, where from this insulin comes? For this, we have to know our pancreas. Pancreas works as exocrine and endocrine gland. Coming to endocrine part, islets of Langerhans works as endocrine gland. In this, islets of Langerhans, four types of cells we can see: alpha cells, beta cells, gamma cells, delta cells. First, alpha cells will be secreting glucagon hormone, beta cells will be secreting insulin hormone. These two hormones will regulate glucose metabolism. Insulin insufficiency or inability to produce beta cells, inability to secrete insulin is called, that leads to diabetes. Okay, that may be of types. In detail, we are going to discussing about that. What are the types of diabetes? Types of diabetes, three types we can see. One is type 1 diabetes. Okay. Second is type 2 diabetes. Third is gestational diabetes mellitus. Okay. Second is, what are the types of? Here in this slide, we can observe currently at least 1 out of 3 people will develop the disease in their lifetime. Okay. Next, what are all the symptoms? Symptoms of diabetes. Diabetes, uh, people may experience, may show three or up to 10 are there. First is polyuria. That is nothing but frequent urination. People go to many times for urination. Okay. Second is polyphagia. Polyphagia is excess appetite. They feel always hungry. Okay. Then polydipsia, excess thirst. Next, they even suffer from numbness in their hands and feet. Okay. Then tingling sensations in their arms and hands and legs. Next, They seem always fatigue. Fatigue means always they look tiresome. Then vision problems also we can observe. Blurry vision. Next, in this slide you can see what are the common symptoms. First, excessive, I have already explained, excessive thirst, that is nothing but polydipsia, excessive appetite, polyphagia, excessive increased urination, that is polyuria, unusual weight loss, weight gain, fatigue, tiresome, okay, nausea, vomiting, blurred vision, and in women, vaginal infections or fungal infections we can see. Then in men and women, yeast infections are common in people suffering from diabetes. Slow healing of wounds and cuts, itching skin in groin and vaginal areas. In this pictures also you can see they will be always tired like this. Then frequent urination, then sudden weight loss, then wounds that won't healing, next always hungry, sexual problems, blurry vision, vaginal infections, numbness or tingling hands and feet, always thirsty. Okay. What are the risk factors? First, what is, before going to risk factors, type 1 diabetes. Type 1 diabetes is also known as juvenile diabetes, usually diagnosed in children and young ones. When body's own immune system destroys the insulin cells, that is nothing but beta cells. Okay, it when beta cells are destroyed, those beta cells are unable to produce any amount of insulin. Okay, then body does not produce any insulin. This is not preventable. Okay, next, type 2 diabetes. Mostly in India, 90% of people are 90% of the cases are suffering from this kind of diabetes. Okay, used to be called as adult onset or NIDDM. NIDDM is non-insulin dependent diabetes mellitus. Okay, body can. What is this type 2 diabetes? Body cannot use insulin properly. Okay, most cases this can be prevented. Risk factors. What are the risk factors? Risk factors, coming to risk factors, there is genetics. When their father or mother, grandfather, grandmother, anybody, so in-laws, anybody suffered from having a history of diabetes, then children also get this. Okay? In the family, when family history is there, people may suffer from, those coming from that families may suffer from this diabetes. Okay, family history. Polycystic ovary syndrome. In some ladies will be suffering from polycystic ovary syndrome. Polycystic ovary syndrome also causes diabetes mellitus. Next, irregular menses. Menses problems also leads to diabetes mellitus. Some of the races, African Americans, Hispanics and Asians, whites, these races will suffer from diabetes mellitus. Age. Age, usually after attaining the age of 45, you can see This diabetes mellitus, people those are not maintaining a healthy lifestyle, but increases in younger adults and children also we can observe. What are the environmental factors? Environmental factors are inactivity and weight gain. Coming to genetics, genetics, sometimes genes, because of genes. Next, family history. Next, polycystic syndrome, irregular menses, races, then age. Next, environmental factors, inactivity. Inactivity means nowadays people are sitting in front of computers, sedentary lifestyle. Physical activity is very, very less. Then that leads to fast food. Fast food also one of the main tasks to gain weight. Okay, these are the risk factors. Next, what is gestational diabetes? Gestational diabetes mellitus is nothing but having diabetes during pregnancy. How it comes? Prior to pregnancy, when they are overweight, this problem may occur. Or genetic history, genes. If at all they are having family history, they also get this gestational diabetes mellitus. Having gestational diabetes puts you at risk for diabetes type 2. In future, they may get diabetes, type 2 diabetes, that is diabetes mellitus. In this figure, you can observe high blood glucose levels in mother leads to it will goes to the baby. That will leads to causes the baby to put on extra weight. Okay, this is about gestational diabetes mellitus. Okay, coming to the complications of uncontrolled diabetes. What are the complications of? First, retinopathy. Retinopathy, in symptoms only we have discussed about blood vision. Their vision will be blurriness. Blurriness means no clarity in vision. They will develop cataracts. Okay, cataracts and blood vessels or arteries in the retina will rupture. That may lead to permanent blindness also. This is retinopathy. Next, nephropathy. Increased levels of blood glucose leads to kidney nephropathy, CKDs, chronic kidney diseases. Sometimes it may lead to renal failure also. People suffering from diabetes mellitus, they have to, when nephropathy is present, immediately they have to take the advice of their physician and undergo dialysis also. Okay, coming to heart. Heart also, then when people are suffering from diabetes mellitus, those people will be suffering from heart attacks. In these heart attacks, we can see myocardial infarction. Myocardial infarctions, in this, three types will be there. Double vessel disease or triple vessel disease. Okay, and triple vessel or triple valve disease or double valve disease, they immediately that may lead to fatal, that is nothing but death. That leads to single vessel or double vessel, then people may survive because of undergo angioplasty. Okay, this is about cardiac elements. Next, brain. Coming to brain, due to increased levels of blood glucose, arteries in the brain may be ruptured. That leads to clots. That leads to the stroke, brain stroke. Pressure will be increased. That brain stroke leads to sometimes paralysis, or sometimes it may lead to death also. Okay, next, neuropathy. What is neuropathy? People will be suffering from burning sensation on their hands and feet. Okay, or else people will be feeling numbness or tingling sensation on their hands and feet because of loss of circulation to in arms and legs. That lead next. In this figure, you can observe wounds in foot that won't heal, leading to amputation. Okay, how to monitor your diabetes? We have to, before monitoring, we have to know what is fasting blood sugar before taking any. That means you don't know, take any tea, coffee, etc. Fasting means absolute fasting. You can drink just water only. Fasting blood sugar, that is fasting blood sugar. Next is after having breakfast. Breakfast means after having idli, anything, chapati, anything. Okay, that is PLBS. Okay, and random sugar. What is random sugar? Random sugar, anytime if you take blood sugar, that is random sugar. Now we are going to see how to monitor our diabetes. Here, through glucometer, you can check the blood glucose levels here. A blood sample is taken first and kept on a taken and put on a test strip, and here you can see, and kept in machine. Okay, immediately values come. Then you have to keep a logbook of your blood glucose levels. Here, what is the normal level, blood glucose level? While fasting, it is 70 to 100 mg per dl. Post PLBS will be 70 to 140 mg per dl. Okay. In pre-diabetics, we can observe 101 to 125 mg per gl. And in PLBS, we can observe 141 to 200 mg per dl. In diabetics, we can observe 125 to 125 mg per dl and above in fasting blood sugar. In PLBS, it will be 200 mg per dl and above. Okay, these are the ranges. Then we have to take this. Next, earlier only I have told type 1 diabetes can't be prevented. Okay, next is how to prevent. Before this, how to prevent type 2 diabetes. Type 2 diabetes is to prevent three levels are there: primary, secondary, tertiary. What is primary? Maintaining a healthy lifestyle, going for a walk. Instead of taking lift, go take staircase. Next, healthy, avoiding fast food, avoiding whites. Next, balanced diet should be balanced diet should be taken. Secondary, it is very, very important. First also important, and second is check HbA1c and adjust diet. If at all, what is HbA1c? It measures blood sugar average over a span of 3 months. It measures blood sugar over span of 3 months. What is it measures what of your hemoglobin is coated with sugar. In this normal, what is the normal range of HbA1c test? 4 to 5.6 is normal. Pre-diabetes is 5.7 to 6.4 and diabetes is 6.5. Okay. In this, if at all we observe above 5.4, 5.6, immediately this will be considered as pre-diabetes. Then diabetes will be 6.5. Depending on the values of HbA1c, you have to adjust your diet. Okay? You did in a controlled manner. You have to take 1 full cup, 1 cup of rice, vegetables, dal, curd. Very little you have to take. That too cup only. Next tertiary, exercise and eat well. Eating well, and these people will be suffering from B12 vitamin deficiency. So they have to take vitamin supplements also. B12 vitamin is available in red meat only. Next, examination of food. Any fungal infections are there, immediately then also immediately take care of the food also. Keeping your food clean. Okay. These are all the, and afterwards, if at all people are suffering from diabetes mellitus, they have to take medication. Okay. And sometimes they have to take metformin, like metformin, then glyphosate, like these medicines are there. If at all uncontrolled diabetes, physicians may prescribe insulin shots also. When these, whenever you are taking medication, first you have to take sufficient lunch. Afterwards only you have to take our breakfast, then only you take the medication. Or else it may lead to hypoglycemia. What is hypoglycemia? Blood glucose levels will be below 60. That leads to hypoglycemia. 70 below leads to hypoglycemia. That is also very problem. That may lead to problem. Okay. Then hyperglycemia. Some people may suffer from blood glucose levels will be up to 500 also. That leads to diabetic ketoacidosis. This leads to people will be suffering from loss of memory. They don't orientation. They lost orientation also. So that should be immediately checked by your physician, and those who are having more above 300 mg per dl leads to ketoacidosis. This is also a very fatal condition that leads to sometimes death also. Hypoglycemia, some people without eating only they take medication at night time and they don't feel hungry and then take in insulin shots. That is also very dangerous. Whenever you are taking medication for type 2 diabetes, you have to take enough food, which is how your dietitian told, or else that may lead to insulin hypoglycemia that may lead sometimes blood sugar levels will be below 50, that may 30, that may lead to diabetic coma also. This diabetic coma, which may be leads to death also. That is called as insulin shock. Shock, SHOCK. So people are advised to take, and people who are suffering from this diabetes are advised to take biscuits with them. Whenever they are feeling dizziness, that is a symptom, their blood glucose is lower. So immediately they have to take chocolates or biscuits. That will be sometime. And moreover, if at all any emergency occurs, you have to consult your physician. Precautions at home only, you can give sugar and sublingual. If you keep sugar or ice cream sublingually, those suffering from hypoglycemia, that may leads to betterment of that particular individual. So these are all about diabetes. Okay. Thank you, Thank you.